Good morning. My name is Danny Song. I'm at Johns Hopkins University. Pleased to share the stage with my fellow speakers here, and here to discuss the BioProtect Balloon in regard to the data. We have a multinational randomized pivotal study which was performed. Happy to share those results with you, and that is in press in the Red Journal coming out soon. The study objectives were to assess the safety and efficacy of the balloon in patients undergoing IMRT. It was a multi-center randomized trial, subject-blinded, phase 3 study, 222 subjects randomized 2-to-1 to balloon versus control, 16 sites enrolled patients. And there were two co-primary endpoints. One was the efficacy endpoint to achieve a greater than 25% reduction in volume of rectum receiving 70 gray in over 75% of the balloon subjects. The safety endpoint was for non-inferiority in rectal and implant procedure-related adverse events. And there were some secondary endpoints, including rectal prostate separation, additional measures of radiation dosimetry and patient-reported quality of life, and as well as balloon visibility and degradation at 6 months. And these are the sites which enrolled, so very grateful to the patients and the investigators who participated in this study. When looking at the patient demographics, they were equally distributed, no significant differences between the balloon and the control groups. And of note, there were 25 subjects who actually had a prostate volume over 80 cc's, which is a little bit different than the other spacer trials which have been performed. So the efficacy endpoint was achieved. 97.9% of subjects achieved a rectal dose reduction of over 25% in the rectal V70. And so this was pre-implant CT scan and then post-implant planning study performed. And plans were generated using Very and Rapid Plan. So when comparing those two plans, you see that the pre-treatment was 7%, RV70, and post-treatment was 1.1% for an absolute reduction of 5.9%, a relative reduction of 84.8%. So this is a distribution of the mean doses, and as you can see, the V70 again declined by 5.9%, and there was about a 10% difference across the board in the other metrics, including V40 through V60, as well as a small reduction in the V80s. With regard to safety, and this was any grade 1 or greater rectal or procedure adverse events through 6 months. These were all independently reviewed by an expert committee, which was blinded to the patient's assignment. The balloon group had an 18% incidence of grade 1 adverse events, and the control group had 23% for an absolute difference of 5.1%. If we look at IMRT-related rectal adverse events, that was 10.1% in the balloon group and 21.8% in the control group. So these differences met the statistical endpoints. The spacing distance, the mean distance at mid-balloon is about 20 millimeters. So this is injecting about 17 cc's of saline. And this was very stable over the course of treatment. So an end of radiation treatment scan was performed, and that showed basically a 1 millimeter decrease in the height. So it was very reliable in maintaining consistency of spacing through the course of the radiation treatment. And for comparison, these are the other products showing that notably Space OER reported a 28.6% reduction in the spacing between end of radiation and beginning of radiation. The balloon resorption was also very reliable. So at 6 months post-implant, there was another CT scan performed. 98.5% of patients in the balloon arm had complete resorption observed. And again, for comparison, you can see that in the Bear Gel trial, there was some residual material left even by 12 months. So if we look across these three studies, pretty comparable in terms of the number of patients enrolled. The safety endpoints was either 6 months or 3 months. Of note, in the balloon trial, there were some T3 patients, and they were allowed as long as there was no extracapsular extension on MRI, as well as any prostate size. So there was no limitation on the prostate size, which again resulted in those 25 patients with over 80 cc glands. One other key difference is that the treatment planning for the comparisons was done by the core lab and using somewhat automated planning with Rapid Plan, whereas the other two trials were manually planned. Comparing the efficacy endpoint across the spacer trials, what you see is the balloon post-implant, the V70 was the lowest in comparison to the others. The pre actually was also the lowest, so it does make for a more challenging comparison. And that's why you see the absolute reduction of 5.9% versus 9% and 8% in the other studies. And we think that's a function of the planning that was used. Comparing the safety outcomes, Space OER reported both grade 1 and grade 2. So if you look at those, the grade 1s were actually higher in the spaced patients, and modest relative difference in the grade 2s. And then Barrigel reported the grade 2s. And as you can see, the balloon, the relative differences were significant, both for grade 1 and grade 2 at 6 months. So in summary, the randomized trial showed the primary efficacy endpoint of reduction in rectal V70 was met. Over 95% of patients achieved a greater than 25% reduction in V70. There were lower overall grade 1 rectal adverse events through 6 months in balloon versus control. And there are longer-term follow-up data which will be analyzed and forthcoming. The balloon was stable, there was a lack of migration, and 98% rate of balloon degradation by 6 months, and at least preliminary comparisons versus other spacer material is favorable in terms of patient tolerance and consistent rectal dose reductions. Thank you.